Hello everyone, Dr. Jake's here from the Sports Pod. We are gonna do a 20-minute mobility series starting with wrestling. So wrestlers, we see a lot of hip, low back issues. We see a lot of shoulder issues. And when you wrestle, a lot of people hang on your neck, bend it, twist it in weird positions. So we're gonna do one entirely for the neck as well. Obviously those things kind of intertwine. First we're gonna start out with our low back. Whenever we do this, we're gonna smash first. So we're gonna grab a ball right here. I'm gonna use a lacrosse ball for my erector smash. And the reason for that is we want a smaller ball because we're getting into a little bit of a smaller muscle, a very superficial muscle here, and we want to smash it with this ball. We don't want to use a tennis ball or a racket ball or anything with too much give. We want a pretty firm ball to get into the tissues because we're going to want to add a lot of tension to it, okay? So how do we find our erectors? Our erectors line our lumbar spine, okay? They basically go up from your pelvis all the way up into the base of your skull. These muscles right here. So the easiest way to find them is we find our spinous process, or that little bone in the back, the center of our back, and then we go out about an inch, okay, in either direction. I'm gonna start with the right side, okay? So I'm gonna put the ball right here. I'm going to ease into the ball. My feet are touching the floor. My knees are up, and the ball is in my right erector, okay? So I'm gonna move the ball up and down my right erector, and I'm gonna find a tender spot. Found it, okay? So what we're gonna do now is I'm gonna take my right knee, bring it up to my chest. Left foot stays on the floor. My hips come off of the floor, and I'm driving into the ball as much as I can tolerate, okay? And we're going to extend the knee. And then we're just gonna keep on going through this range of motion over the course of 2 minutes. If our hip gets tired at any point, the resting position is bringing our knee up and holding it like that. That's gonna put the most tension on the erector as possible. But if we can, it's best to keep moving throughout the whole process. Why do we use smashing for 2 full minutes? It's because muscle responds to 2 main things. First, being time, the second being tension. The tension should be pretty obvious right here. For most of you who are playing along at home, we're adding a lot of tension to this muscle. It's probably pretty uncomfortable. And we're also applying tension, moving our leg up and down like this. The time, research has shown, and what we see in the sports pod a lot, is about 2 minutes, okay? You may have done some stretching for less than 2 minutes, some smashing for less than 2 minutes in the past, and you may have noticed some temporary benefits from it, like, oh, I feel good for a few minutes, maybe an hour, and then it kind of goes back to how it was before. And we'll talk more about that, but first we're gonna switch sides. So I'm gonna take that ball, put it in my left erector, bring my left knee up this time, and go through that range of motion and hip flexion into hip extension right here, okay? Hip flexion, hip extension. What we're doing when we're smashing, the tension signals our central nervous system, means like our brain, right? That, hey, something's not quite right here. There's a lacrosse ball here and it's causing a lot of pain, and it probably shouldn't be causing this much pain. So what it's gonna do, it's gonna send some chemical signals locally and from your central nervous system that are gonna decrease pain. Same thing we see with dry needling that we do here a lot as well. It'll be local opioid release from even the skin cells can release opioids, pain relieving chemicals into the area. But we're also remodeling the tissue. There's this blanket that overlaps our muscle tissue called fascia. And when we smash into a ball like this, if our fascia is not sitting quite right, maybe restricting some motion in our muscle, causing some pain, this sort of tension and this sort of time will signal our body to send help to that area through something called fibroblasts and lay down new tissue, and it'll orient it better. There's some really cool microscopic slides that I saw recently at a seminar that I went to over the weekend of some of this change before and after we add tension. In that case, is what it was with a dry needle. All right, and then we can ease off of that. Next, we are gonna find a chair or a table, preferably a hard surface, and we're gonna smash into our hamstrings. Our hamstrings originate from our ischial tuberosity, which is our sit bone right back in here, and they go down into our lower leg, back in through here. We are gonna start, we're gonna focus on the lateral one today, okay? So that's our biceps femoris longus in particular. The best way to find that, it's pretty easy. It runs from here to here, right? So we're gonna go about mid-thigh, and we're just gonna cheat to the outside of our hamstring, okay? So mid-thigh, cheat to the outside of our hamstring. To add extra tension, I'm gonna take my hands, press down into my knee, and kind of use that leverage to add as much tension as I can tolerate. The motion, as you can see with this one, is knee extension and knee flexion. So you may have noticed with our erectors and this one, we're not moving the ball around too much, right? We're just leaving the ball right where it is, trying to find that one tender spot. It's usually a trigger point, the one tender spot in our muscle. We're leaving the ball there, and we're kind of gliding that muscle over the ball with the extension and flexion of our knee or in our hip in the case of the erector smash that we just did. We see hamstrings get very tight in wrestling very often because of the grappling, especially on the mat that we see. You know, a lot of athletes who are riding legs and maybe elevating the ankle, which I really like to do a lot when I was wrestling. You may remember in the first day of wrestling practice, getting back to it, trying to grapple on the mat, everyone cramps up because we haven't used our hamstrings. There's not a lot of exercises that really simulate what the hamstrings are needed to do in a wrestling match. So we can switch sides. Again, cheating towards the outside of our leg and pressing down with our hand. Something important to mention, if we feel like a burning sensation down the center of the back of our leg, the center of our posterior leg, kind of like a burny, shooty sensation, we don't really want that. We want more of like a dull ache, probably like a 4 or 5 out of 10 on the pain scale. If we're feeling that burning sensation down our posterior thigh, we're probably hitting our sciatic nerve. We're probably aggravating that sciatic nerve. And it's just something we want to try to avoid. It's not the end of the world, but it's not the tissue that we're targeting. So if you're feeling that, try and ease off of it a little bit and try and move the ball more towards the outside of our thigh. So the hamstrings, like I was saying, the hamstrings can get very aggravated during wrestling, especially early on in the season when our hamstrings, our legs aren't really conditioned to do what they've been doing if we haven't been wrestling as much or as hard as we probably should have in the off season. So that's why hamstring is good to focus on. Hamstrings can cause a lot of problems, right? We all know tight hamstrings, crampy hamstrings aren't a good thing. But what it can actually do is pull on a ligament in our pelvis that up the road in our low back can cause some low back pain. See it very commonly with wrestlers, and that's why we really like to focus on the hamstrings and the erectors. Almost done here. About 5 more seconds. Good. Okay, so the really uncomfortable stuff is out of the way. Now we're gonna get some more fun, stretchy, stuff that kind of feels good. What we like to do is called a car. This, we're gonna be focusing on our hip right here, okay? So this would be a hip car. CAR stands for controlled articular rotation. I'm gonna grab this dowel here just to balance myself, but we could easily grab onto a rig or a wall, whatever you have around you, just to help you balance, because this is kind of an intricate, tough movement to do if you're just standing out by yourself. So grab a hold of something, and here's the pattern. We're gonna come up into flexion, come out into abduction. We're going to internally rotate our hip, come back around into extension. From here we freeze. Very commonly we see people go back and then they start over again. That's not what we want to do. We come back into extension, abduction, external rotation, and back to center, okay? Something that'll help you remember the pattern here. When we come out into abduction, this is when we always rotate, right? So I always think my heel leads the way, or my foot leads the way. So when I'm on my way back, I'm gonna come into internal rotation, into extension, and on my way forward, I come into external rotation, into flexion, okay? So 3 things we wanna be focusing on in our hip car. Number 1, we want to make the biggest range of motion possible, meaning we want to make the biggest circle, the biggest rotation in our hip that we can possibly make. Number 2, we want to do it pretty slow and controlled. We want to hit every single aspect of that range of motion that we can. Want our muscles firing where they're supposed to for smooth, slow range of motion. And number 3, which is the toughest one in my opinion, is we want to isolate that motion. Meaning we don't want our hips to shift, rotate, and we definitely want to avoid lumbar extension. It's very common. How we avoid that is we keep our abs tight throughout the range of motion. Do one more rotation before we switch legs. Another one you may notice that you're trying to compensate is that we're kind of hiking our hips up like this. Looks like this. When we come out here, we want to hike our hips up. Try not to do that. Isolate that motion and come back to center. Okay? Let's switch sides. Again, coming up into flexion, abduction, rotation, coming back around. When we come back around, it's very common that we see that lumbar extension. We really want to try to avoid that. A lot of the times we hear, you know, we have low back pain because we're compensating for something, right? Well, that's a very good example of it. If we lack hip extension, right? So hip extension, and we want to get this knee back farther, what do? We compensate it in lumbar extension, right? You see how I didn't really move my hip, my knee moved back because my lumbar is extending. My lumbar spine is extending. Why do we want to try to avoid that? We all know, you know, in a flexed posture, under load, we can get some back injuries. Everyone knows we should avoid that, right? Well, the same is true for lumbar extension. In fact, we see more injuries at the sports pod from lumbar extension under load than we do from lumbar flexion. It's surprising, but it's true. So that's why these cars are such a great tool to use. In just our daily maintenance, put them in your warm-ups, your cool downs. When you're bored, you can do them at the bar, you can do them whenever you want to, as long as you don't care about getting weird looks. But it's a great tool to learn how to move our body, how to be strong at an end range of motion when our joint's most vulnerable, right? And how to isolate that motion to avoid compensations that can lead to pain down the road. Good. And relax. Okay, so the cars are out of the way, the smashing is out of the way. Next, we're just gonna get a quick little stretch in, okay? So our first one, our go-to with low back pain, we're gonna do a couch stretch, okay? I'm gonna take my yoga blocks and put them back here just to get a little bit of flexion in my knee, okay? So I'm gonna come out here, put my foot on that yoga block. I'm gonna come up into a couch stretch. So we're gonna focus on hip extension here. There's a variation of the couch stretch where my foot is higher up, and that's just gonna focus a little bit more on the quad muscle called the rectus femoris, okay? For this one, we're focusing more on the psoas, which is hip extension. Okay, so again, my abs are tight, and what I'm gonna do is I'm just gonna take this hip standing tall, and I'm just gonna push it forward, and I'm gonna start to feel a little bit of stretch in through here. Perfect. Okay, the last step is tricky, it's subtle, but what I'm gonna do is I'm really gonna tighten up my abs, and I'm gonna try and tuck my pelvis underneath, or posteriorly rotate my pelvis, okay? It's very subtle, but how I do it is I'm gonna squeeze my abs really hard and squeeze this right glute, okay? And now I feel a very, very hard stretch right in through here, right where we want it. Our psoas is a very, very important muscle when it comes to low back pain. It connects from the top part of our femur here, and it goes into our lumbar spine actually. When people say, this is like my hip flexor is tight, this is usually the muscle they're talking about. This is the primary hip flexor muscle. You can imagine, since it does actually connect into our lumbar spine, that if it gets tight, gets shortened from sitting a lot, right? This would be like a sitting position with my left leg. My left psoas is in a shortened state, which is fine for 2 minutes, right? But it's not okay for 8 hours a day, which is probably how long most people are sitting in a day, probably a little bit more than that. So what we're doing here is we're stretching that muscle out, trying to just get it okay with being in a lengthened state so it's not compressing onto our lumbar spine and it's not restricting hip extension, causing compensations like lumbar extension. And we're gonna switch sides here. So again, abs tight, pushing that hip forward. I'm gonna squeeze my abs a little bit more. I'm gonna tuck my pelvis underneath. I'm gonna roll it posterior. Squeezing my left glute. Yeah, and I feel a lot of tension in through here. So the reason we don't want to overextend our spine, especially under load, is we have a limiting bony factor in our lumbar spine called a facet. right? They're just little joints in the posterior aspect of our spine. And when we go into extension, they actually kind of jam up into each other. Now, if we have a psoas that isn't aggravated, isn't shortened, isn't tight, and we're not adding a bunch of load to lumbar extension, for example, like some gymnastics motions, you'll see some lumbar extension. Not a big deal if everything's moving properly and our psoas is fine. Because we're not under load, they're actually kind of distracting the joints, right? In those gymnastics types of movements like pull-ups, ring muscle ups, whatever you want to call it. What's not okay, like in wrestling or weightlifting, when we extend our spine, jam those facets together and add a load to it, so now we're compressing the joint even more. It's really going to aggravate those facets and the nerves that are around it. It can cause referred pain down into like our low back, our leg, even down into the back of our thigh. And kind of mimic what people would call like a sciatic pain or something like that. May just be in the facets. So that's the first thing we want to worry about, the first thing we want to try to avoid when it comes to moving our body under load, like we do in wrestling a lot. All right, and relax out of that. This is a broad sort of, let's try and check all the most common problems we see in wrestling with our erectors, our hamstrings, and our psoas for low back pain. That may not be the issue for you. If you are experiencing low back pain now, we would urge you to reach out to us at the Sports Pod. Leave a comment in our YouTube page. We'll get back to you for videos you want to see in the future. If this helped you a lot and you just want to say, hey, this was awesome, we love that support, share it with your friends, subscribe to our page, and tune in next time to this series where we will be going over the shoulders in our next series. Very common to see shoulder injuries with wrestlers, especially if they lack flexion right here. So that's primarily what we'll be focusing on there. Thanks for watching. I'm Dr. Jakes from the Sports Pod. See you next time.